Ganja high schools, marijuana-laced cookies, the rave among St. James students. That was the headline of an article published by The Gleaner over a week ago. Joining us to discuss the use and misuse of marijuana in schools are research analyst at the National Council on Drug Abuse, Ruki Atkinson, and NCDA's Youth Ambassador, Brittany Taylor. Good morning, ladies.
Good morning.
Welcome to Live Jamaica.
Thank you.
Wow! Ganja high schools, what a headline. Okay, I'm going to start with you. What does the research say about the prevalence of the use of ganja in schools?
Okay, so we conduct a number of studies among secondary school students. These are students ages 13 to 17. And what successive studies have shown, well, first of all, we measure it in different ways. So there's lifetime use, have you ever used it at all? Which is generally those who have experimented and so on. You have past year prevalence, and you also have current use, which is use within the past 4 weeks. Our last study was a global school health survey in 2017. This is using the WHO PAHO's methodology, etc. Right. And what it has shown is that our lifetime prevalence is just over 20% of our students. And current prevalence is about 12 to 13% of our students. What successive studies have also shown is that prevalence is highest among males than females, even though the gender gap is decreasing, meaning more females over time have reported using. It has also shown associations between use and exposure, so whether your parents use, whether your peers use, risk perception, if it is low, if you think, oh, there's no problem if I use ganja. Access and exposure, those kind of things are associated. Also, prevalence has been significantly higher among fourth form students consistently over the years. Now, we don't know the reason for this.
Fourth form.
Fourth form students.
Is it transition,
That's what
between
different theories have
and
said. Yes, so you feel like you reach now, or, if CXC hasn't come yet, whatever the reason. But we've also conducted focus group discussions among youth. No, the headline is not only about St. James High Schools. It is across the board. So there are things like edibles that are now coming on stream, vaping marijuana as well. And our young people have told us that, eating ganja is not necessarily as bad as smoking. So there is a lot of confusion regarding the impact that it can potentially have on them. And so, yes, so...
You said it's not just St. James, so your survey covered the entire country?
Absolutely. Our surveys are representative of the entire island, and our focus group discussions, where you get really into the meat of the matter, have also been conducted across the board.
Brittany, as a youth ambassador and peer educator, what are you asked to do?
Okay, well, first, I volunteer. So I started at a really young age, and there are different activities that I participate in. So, for example, I was just able to go to a youth conference overseas where we were trained, and it was a number of persons from all different CARICOM countries. Also, I helped with mounting exhibitions.
Sorry to jump in. Trained in what? Trained in what?
Helping youth with drug prevention. And I also helped to mount exhibitions, and I remember there was one program that really got me going for being an advocate at the National Council on Drug Abuse. It was the READ program when I was younger. I helped. It was resistance education against drugs, and it was for grade 1 students. And they were basically taught about like knowing the difference between good and bad drugs, identifying their different emotions and how to talk about their feelings and how to say like no to negative things. And I remember they were so receptive to the information, and up to this day I'm hearing that they're still talking about it because they were able to participate in like a quiz competition. And
Can I just say one more thing?
Sure.
Brittany is one of 6 youth ambassadors who have represented Jamaica in Vienna at the International Youth Forum, which is put on by the UNODC. And they also won the forum in the Caribbean. It was the Inter-American Drug Abuse Control Commission that put it on. Jamaica was one of 3 winners for the competition.
Brilliant. Congrats. Back to your survey.
Yes.
When them smoke, where them smoke, is lunchtime, is during school, is after school, is before school?
All of the above. So when we look at locations and so on, when we looked at disaggregated the data looking at both ganja and alcohol, alcohol use is more at sporting and social events, while ganja use was more reported at home and in the community, at friends' homes and that sort of thing. In terms of access and exposure, at the school gate or in and around school compounds, over 50% of the students reported that there is easy access to these substances in areas that are supposed to be protected areas.
Brittany, so now you're now a peer educator.
Yeah.
What are you required to do? How do you see yourself making a difference in this issue with the youth?
Okay, well, as youth, sometimes we find it hard to talk to adults. We like to talk to people who we can relate to, people who they go through the same struggles as us. So going through the training, what we were taught different life skills such as communication and rapport building, as well as how to be a servant leader. And it taught us, for example, how to be active listeners. Sometimes our youth, they just need a listening ear, or how to be create a non-judgmental space when you're and how to relate to them at the stage that they're at, as well as how to put others before yourself and be caring, and how to empathize. So that's what we're basically required.
Yep. Do you know of students, maybe, I don't know if you're still in high school, because you look like you're still in prep school. But do you know of students personally that used to smoke and drink while at school?
Okay, but yes, I do. I've seen that. I'm currently at the University of the West Indies, but in high school there were some incidents.
What made you stay away from it?
My parents, they were definitely my backbone, and good influence surrounding myself with positive influences, my friends.
What is Talk the Truth?
Talk the Truth is a ganja prevention program that has been developed by the NCDA. Following decriminalization, what we found was that there's a lot of confusion out there as to, what does it mean? That mean it free up. That is what was the perception. And certainly among youth, you want to be able to clarify what the impact or the potential impact. It may not happen, but there is a possibility. What our studies have shown is that 1 in 5 adolescents who currently use ganja are at risk to become misusers.
I want to jump in again, because you just said because it free up.
Yes.
Talk to me about that. What age? In other words, if a police officer see a student smoking a spliff, I think if him say me smoking a spliff, I think I get a ticket.
Right. It's a ticketable offense.
Right. So if he sees a student, what happens?
What is supposed to happen is that individual is supposed to be referred to the NCDA for follow-up action.
Even if he's an 18-year-old student?
Under 18.
Under 18.
Under 18.
But if he's a sixth former?
He's a sixth former, he's supposed to go to the NCDA for intervention, because you're not supposed to be drinking or smoking. But under the...
No, I mean, if you're 18 years old.
Yes.
And I still go to school, I still in my uniform, and a police officer see me that split.
Under 18,
no,
you're supposed to be referred. Over 18 and over,
you get a ticket like me.
ticketable offense. But we don't have the tickets yet, as you are well aware.
Isn't that one of the problems, though?
It absolutely is. And also, the enforcement of some of the things that we have on our laws, the laws that we have in place, enforcement is a problem. So nobody is asking for an ID if a young person comes up and says, I want to buy a Guinness or a bottle of rum. That's not widely enforced. So that's one of the barriers that we have found to effective prevention and interventions that we're trying to do.
Have you ascertained how it affects learning?
Absolutely. So internationally, studies have shown that, especially when onset of use is early, there is an association with learning, with memory, with IQ levels, and so on. So what we try to do is delay the onset of use. Our studies have shown that the average age of onset is 12 and 13. Now, the earlier you use, the more likely it is that you will progress to habitual use, and then you may also progress to problematic use and misuse and disorders. Most people don't progress, but certainly we don't want to even, enter into the possibility.
You got the wrap-up signal. Is it fair to say that the NCDA does not agree with the fact that marijuana was decriminalized?
You're putting me on the spot there, Neville. certainly what we would say is that the NCDA is concerned about measures that need to be in place to protect the vulnerable. So there is a reason for decriminalization, which has been articulated, to declog the justice system and so on. Those things we understand. But certainly things would need to be put in place to ensure that the youth, persons with mental illness and all, other groups that are vulnerable, that measures are there to be able to protect them and intervene.
And you're not impressed that those things are in place?
Absolutely not. We need to do much more. Certainly public education and those sorts of things are, expensive, and it needs to be sustained.
Fantastic. Good to see you. Another young person I'm impressed with this morning.
Thank you.
Continue to do what you do. And congrats with what you have done. What you going to be at what you studying at?
Biomedical engineering.
Biomedical engineering. Make him spell them. Good luck with that.
Thank you.
Luki Atkinson, research analyst at the National Council on Drug Abuse, and Brittany Taylor, NCDA's youth ambassador.
Up next, a force for good, policing through partnership, keeping you safe. We'll discuss that after the break.
Soon come.